in the lower jaw has some deep bone loss compared to the adjacent teeth that also has some bone loss, but obviously the area where there is some potentiality to regenerate bone, it's only the area between the two central incisors because of the vertical component of the defect. The main objective, obviously, she's a very, very young girl. How old are you? Quanti anni hai?
30.
She's 30 years old, so it's really a very, very severe and aggressive form of periodontitis. And so we are doing our best to keep the old teeth of the patient's mouth. We have already treated almost all the area. Then I will show you the radiological status, so you can realize how severe was the periodontal disease of this patient, but we are sure that we are going to keep the old teeth of the patient's mouth for as long as possible. And this is an area, if we are able to improve the soft tissue situation together with to improve also to the bone, this has a very, very good prognosis for the future. Now I will show you the clinical aspect. The mucogingival situation, it's absolutely unfavorable for the regenerative purpose. We have a recession on the two central incisors, very, very lack amount of keratinized tissue at the buccal aspect of the two teeth with the intrabony component of the defect. So we have to perform a surgical procedure that should be as much as possible in the same time a mucogingival and regenerative procedure. And this again will be performed by adding the coronally advanced flap plus connective tissue graft, which will be used as a wall in the same way we have seen this morning. A different approach in terms of papilla preservation will be used at the level of the defect, because we cannot make the same incision in the palatal aspect, where unfortunately in the lingual aspect we don't have the same thickness of the soft tissue we may have at the buccal aspect or the palatal aspect in the upper jaw. Okay, now we make anesthesia. Non cominciare a soffrire, non sentirai nulla, ok? In terms of the surgical approach to the defect, we will use a technique that is exactly the opposite of what I showed you this morning. So we will make a split thickness incision in the buccal aspect, and the whole tissue covering the bony defect will be shifted in the lingual aspect, where I will avoid any opening of the flap. So it's a single flap approach at the buccal aspect. This will give me the opportunity to, as you will see, to verticalize the supra-bony connective tissue and allow the flap to be advanced more coronal with respect to the starting point, and the connective tissue graft will be used to give stability to this flap. So it's really another quite complex surgical procedure. Hai sentito che vogliono togliere la parodotta aggressiva? Non era l'unica cosa carina?
No, cioè, è stata una cosa che ha lanciato.
Sì, sì.
Poi non lo sapevo. Chissà, non è che deve uscire. Va bene, perché tu fai così, quando è che c'è la cosa? Prima di
Dicendo, sì. No. E allora?
Poi dicevo, invece ho guardato, eravamo buttati in 10.
Invece?
Ma invece 50.
Quindi hai perso di pochissimo.
Di 3 voti.
Ah, addirittura. Vedi che bisognava votare.
Almeno ho detto, dai.
No, bisognava non votare gli altri per...
Qualcuno. Sì. Invece gli altri. Di 3 punti.
E chi è che è arrivato davanti a te?
La mattina con Simone Fabrizi che ha preso 56, la mattina invece 63, Ruppe 65, con gli altri Donasiero che corrono 80-90.
La cosa migliore, così non ti devi sbattere
Mi devo sbattere
e al tempo stesso...
3 voti.
Esatto. The anesthesia is always performed far away from the surgical area. Now we take some... L'innesto l'avevo preso da qua, vero? Quando abbiamo fatto dalla
in
parte
alto.
anteriore. A sinistra?
Sì,
Sicura?
sì, spalato intende.
Sì, sì. Aperto bene? Ah sì, perché di qua c'era la zona di guarigione. No, su questo lo fai vedere dopo, dai. I'm just making some anesthesia in the palate, as I told you yesterday, in order not to make the patient feel anything. La Valeria perché non viene qua con noi? Open please.
Dov'è Valeria? Falla vedere.
Okay, so we have to perform a coronary advanced flap together with treating the intrabony component of the defect. Tieni qua.
Chi mi dà una mano di là?
The approach, chiude pure un pochino, tirare bene. The approach is very very similar to the same we used yesterday. So it's a trapezoidal type of flap. With true horizontal. And true vertical release incision. So this is the first papilla elevation.